Valdosta, Georgia, home to over 55,000 people. Like many communities across America, disparities in healthcare have plagued this town, where until recently, brain health and dementia awareness have not been a major focus. What is Alzheimer's?
Well, I couldn't tell you exactly myself. The education of it is not very clear in our areas.
Alzheimer's is a disease, a problem that I can't explain.
Oh, Lord. Well, Alzheimer's is a delay, a disorder, a disease that is within the brain.
It has to do with brain health, and I apologize, I don't know exactly what is Alzheimer's.
I'm not sure. I'm studying up on it.
What is Alzheimer's? It's a form of dementia. It affects the person thinking, what they can remember or can't remember. And it can be pretty devastating for any person and family.
As a layman, I would say that it's a degenerative disease of the mind that progresses, sometimes slow, sometimes fast, but always in a miserable way.
Mostly we think it's in older people. There's some young folks with Alzheimer's as well.
Even though we hear about it now, in terms of how long it's been a diagnosis or a familiar term in society, that's only been like maybe 30 or 40 years.
Where are we going? We went to the park?
People of color, black and brown people, people that look like me, are at the top of the food chain with respect to dementia. Why is that so?
Education is a big problem here with dementia.
Education of mental issues or challenges are not something that we really readily get made aware of.
We know based on research that 1 in 4 doctors have very little training when it comes to dementia education. I would love to see better relationships with the medical profession so they can be trained in how to engage with someone living with the dementia. I do believe, in my most humble opinion, that the cure is going to come out of a clinical trial.
We can get African Americans in clinical trials when we actually do targeted outreach to those groups instead of doing this blanket, hey, we told them, oh, it was on this website, but most times our people don't have access to those, or they don't have the social capital, or they're not connected to someone who wouldn't even know about a clinical trial.
I know clinical trials are important so we can have better health.
Basically, it's a test. Clinical trial, I guess you could say it as that.
Would you volunteer for a clinical trial?
Yes, depending on what it is.
I was asked to have someone come into our community to do presentations on clinical trials. But I said, let's hold off. Give me 6 to 12 more months, because I need to educate the community just a little bit more about the basics of dementia first. We can't jump from not understanding what dementia is all the way to clinical trial.
There's a second guess on whether or not we want to actually be a part of certain trials. There's a mistrust. From a historical standpoint, it takes me to the Tuskegee Airmen.
Do that, draw my blood.
The tests and the experiments that were done, syphilis, if you will, that has provided a traumatic event for African Americans.
And I recognize those historical atrocities, but that can't be the hold back for future involvement of clinical trials that's going to help you. You see, my white brothers and sisters take full advantage of clinical trials. I know and I understand that there's a major distrust when it comes to the healthcare system. I get it. And so my job as an educator is to allay those fears, but recognize the true history of what really happened.
From 1880 to 1930, the Brooks County area of Valdosta had the state's highest number of lynchings. And beginning in 1922, the Ku Klux Klan openly held rallies in downtown Valdosta. Valdosta still bears the burden of its troubled past.
This city and county was known as one of the most racist cities and areas in the nation. It is also said to be the most richest because of the landowners, big plantations.
Mental shackles is real. Where the term comes from is the fact that we are in the Deep South. We, as African Americans, have been traumatized over years to where that trauma goes and permeates through generations.
This community is probably close to 60% Black folks, 30-40% white folks. I would love to see a eureka, if you will, of people in this community kind of waking up.
I said, this is the day that the Lord has made, and I will rejoice.
I want people in the community to not be shackled in any way.
Structural racism and the disparities between rich and poor are nowhere more evident than in healthcare.
We do have a very large segment of our community that is pretty much central around our Housing Development Authority. And that struggle is ongoing with getting people beyond a limitation of $10,000 a year. Outside of government assistance, you can't afford traditional health care, in other words.
What happens is that they can't gain access to some life-saving health care to kind of deal with some of their acute issues that turn into chronic issues, and then ultimately it's more expensive to get the care they need.
I am concerned about health care and access to health care. It's really interesting living in Valdosta. When we sought out a primary care physician, we had to fill out an application. And what they're looking at is not a medical history. They're looking at your ability to pay.
We have a major problem with that, especially with Medicaid not being expanded to actually provide that for small rural towns. And we've had lots of our hospitals closed down in Georgia. So we're concerned. No emergency service. It resonates with me every time I see that sign. Anybody that gets sick or has an emergency within the city has to be transported 24 to 30 miles. That's a big issue, because that limits the opportunity for people to have some life-saving care immediately.
The affordable health care that they have here, a lot of our doctors do not even accept it. A lot of the services that the citizens need, they cannot get it in Valdosta.
I think some of the Black folks still are just afraid to go to doctors, and they hold on to old remedies. My mother and father never took us to a doctor anywhere. I remember one time a doctor came to the house and it was just $6, and we thought that was a lot of money, but that's all he charged was $6. And I think he really tried to do what's right and tried to take care of us. He was a white fella, and my mother always appreciated him.
Limited resources available to rural communities make Valdosta just one of many cities across the country struggling with healthcare disparities.
We got to get past a lot of the old standards, be more innovative.
What's most important, we still use the church to move the needle forward. The church still is the platform for that.
In Valdosta, BrightFocus Foundation is piloting a new program to address glaring inequities in cognitive health and increase Alzheimer's disease clinical trial participation. Already, the program, being run by Dr. Deborah Tan, is raising awareness, and the community is benefiting.
The changes that you see in Georgia has been awesome. Everybody's together trying to make Georgia the best it can be. And all of us are working together for the same goals, with the brain health. BrightFocus is like what brought it all here to Georgia. Like Dr. Tan met up with BrightFocus, and it's all coming together.
I do understand that things around here needs to change. They need to get better, but they're far better than they used to be. And my only anticipation and hope is that 10, 15 years down the road, it's even going to be better.
Some of us, came here against our will, and some of us came here, or we willed to come here. But we're all here now. And as Dr. King once said, we either will have to live together as brothers and sisters, or we're going to die apart as fools.